All right, May is Mental Health Awareness Month, so Dr. Laura Saunders is going to tackle different mental health issues.
Yes, today we're talking about mental health and really what that means. We certainly talk about it a lot. Hi, Doc. Welcome. Happy Wednesday.
Happy Wednesday to you, Karen Scott. So yes, May is Mental Health Awareness Month. So while we talk about these topics all the time, we're going to kind of break things down a little bit differently. And we're going to talk about like what mental health is, because we throw these terms around a lot, mental health and behavioral health or emotional health. But, you know, what is it, right? So it's a person's ability to fulfill really the key functions and roles in their lives. The ability to learn, the ability to feel, the ability to express emotions, both positive and negative emotions, and really, most importantly, the ability to manage stressors in their life and the relationships around them. And we have good functioning and not so good functioning.
So that's the question, because especially I've noticed teens will throw this around from TikTok. Everyone's self-diagnosing with, oh, I have a mental illness. How do we know? Because just a lot of people, being human is tough. But does that mean you don't have good mental health?
So that's a great question. And yes, I think a lot of social media certainly tosses out terms and you know, people say, oh, I have OCD or I have other things, right? But actually a diagnosable mental condition is actually not that uncommon, but at the same time, there is a reason for a diagnosis, right? In the same way that if you have a pain in your arm, it doesn't mean you have a broken arm or bursitis or whatever else. I mean, you might just have a pain in your arm. You might just have a down day. You might just, you know, it's cloudy out, it's kind of cold, it's May, I want it to be warm, I feel kind of down today. That doesn't mean you have depression. It doesn't even mean you have like a seasonal affective disorder. It just means you're having a down day or a little crabby. So it's really looking at spheres of functioning. So for adults, you know, you have your work, either you work inside the home or outside the home. You have relationships, romantic relationships, extended family relationships, friends and family. How are you functioning in those relationships? Are you, you know, one good day or one bad day is not so problematic. But if you have weeks and weeks and weeks where you're not able to function, or your relationships are hindered, your functioning is hindered in some way. For kids, the spheres of functioning are really home, school, and play or social. So what we look at is your functioning significantly hindered so that you're not able to do and manage the stressors that are in your life?
And if that's the case, then it's time to seek professional help, right?
Yeah, I mean, I do like people to try, right? Try some coping skills, work on relaxation. There's things that you can do. Talk to a friend, talk to a family member, talk to your spouse, talk about these things, because actually there's a reason talk therapy is helpful. And I just had someone say this to me the other day, like, it's amazing when I say things out loud, I just organize them differently in my head. And I said, yeah, that's called therapy, or that's called a friendship, right? So sometimes talking about these things out loud, having someone to confide in, but if you're really struggling, absolutely seek professional help.
Dr. Laura, Scott likes to talk about, we're just going to veer off topic a little bit. I'm wondering if him watching Gianni Versace is bad for his mental health, because... I mean, he's been having some functioning after he watches the show. So we need to talk about watching shows.
I seriously did have problems functioning after watching that series.
Right. And so, you know, what you say to yourself is, I watch this show every night. It makes me so distressed that I can't sleep. But yet I go back the next night and I continue to watch it. What is it about this self-punishment that seems to be unrelenting for me? So it is sort of looking at behaviors and saying, why do I continue to do this? It's like sometimes you have people like going to a drinking bender, and then they say, okay, I'm not going to drink again for the next 2 days. And the next day they go, and then they get drunk again. And they say, okay, tomorrow I'm definitely not going to do this, right? You engage in behaviors repeatedly that actually don't serve to help you. You have to look at it from a different angle, or at least talk about it with someone.
Well, I'm not watching any more of it because it's over. The series is over.
You finished it.
And he just talked about it with you, so we're feeling much better.
We're all set then. Things are better.
All right.
Well, we'll see you next week for more on this topic of mental health.
Yep, we're going to talk about childhood mental disorders next week.
Okay,
sounds
terrific.
good. Thank you, Dr. Laura.